Dessie Ellis.
Grau Mahagut, time on Buick Lower Chair Son on PMB Shaw. The past few years have seen chronic and constant confusion with regard to medical cards. Many of the cases that I've come across in my constituency have simply defied imagination with the reasons why they have been refused our medical cards. We are witnessing a startling fall in the number of persons who are granted or retaining discretionary medical cards. My constituency office has been inundated with medical card refusals over the past year, and with each and every one of these refusals comes not only a heartbreaking story, but it also places a huge amount of trauma and pressure on an increasingly vulnerable section of our community. This Fine Gael Labour government are now implementing the policies of Fianna Fáil, which they so vehemently opposed when they themselves were in opposition. This government must immediately reverse the cuts to discretionary medical cards and ensure that the HSE begins to treat all those who apply for medical cards with the respect and compassion that they deserve. Burdens imposed by medical conditions, illnesses and disabilities must all be taken fully into account, not simply based on income. We are calling on this government in extending free GP care to all to do so on a programme, timetabled and transparent basis, and in such a way that no one entitled to a full medical card under the current rules will lose any of the services provided under the card in the context of a free GP care for all system. Many people who have depended on discretionary medical cards have not retained their cards, and many others who were hoping to receive their cards will not be doing so during the course of this year. In our alternative budget, Sinn Féin provided for an extension of free GP care to all children aged 5 and under, without depriving anyone else of their medical card entitlements. This is the fair thing to do. The current medical card eligibility system is in urgent need of replacement. It, like so many other aspects of the state we are living in, is simply not fit for purpose. I'm a proud Republican and I believe in a real republic. As Republicans, equality is at the heart of all that we believe in, and we strive for this every day in the course of our work and activism. We believe in a new republic, a republic where all citizens are equal regardless of the colour of their skin, their religious beliefs, sexual orientation, where they live or what they do, and a republic in which all citizens have equal access to the services that they need. Any genuine republic will be judged upon how it treats the most vulnerable and those who are most in need of being helped. And for this sitting government, the conclusion reached will not be a good one. Your withdrawal of medical cards from the sick and the elderly is a stain on this state. I would like to read a number of examples of cases that come to my office recently. If you are a cancer sufferer, a multiple sclerosis sufferer, or have Parkinson's disease, you will not get a medical card if your income exceeds the threshold. The current threshold is €184 for a single person and €201 for a couple. The basic rate of social welfare is €188 for job seekers. A discretionary card may be granted where you can prove that the absence of a card is unduly burdensome or cause hardship. But this is very difficult to prove, as there are many debts and bills that are not taken into account, such as the household charge, utility bills, debts and loans, extra costs to do with your illness that are not on prescription, specialist food you may need for an illness, wheelchairs, stair lifts, physiotherapy. Another example, an 82-year-old woman living alone with huge debts due to personal family circumstances with a medical card valid until 2016 was sent a review form last week. This woman will now lose her card as she has a private pension. Over 70s medical cards are assessed on gross income, not net income. So the tax she pays to government on her pension is assessed as income. So this puts her over the threshold of €500. This woman worked from age 14 to 78. Over 70s are assessed on their gross income. So what they pay in tax, pension levies, USC are all assessed as income. Even though they are not income, they are outgoings paid to the government. A man who worked for 40 years in a factory reached 65 and got a pension of €18 a week from the factory. Now has to pay $70.50 per annum for hospital visits and $144 per month for medication, purely because he was unfortunate enough to get a pension from his job, which he cannot return or cash in. I have hundreds of examples like this. We have many situations where people are no longer taking their medication, and they simply cannot afford it. They're cutting back on inhalers, they're not paying their house insurance, they haven't enough to eat, or to eat proper with ailments such as diabetes. The lack of a medical card will have huge consequences for the health services into the future, as people are not taking their medication and their health is deteriorating as a result. They are not eating properly and are suffering huge stress and worry. Old people are in fear of getting sick. Doctors are saying there is little point in prescribing medication as people no longer can afford it. Worst of all, people are dying with stress and worry due to the absence of a car. We want to see GP care for all. That principle one, and that of a public health care system, is one we endear.